Good morning, Professor Olsen. My name is Yvette. I'm going to talk to you about my PowerPoint. I choose to do my PowerPoint on Turner syndrome. Okay, I'm moving to the next slide. Turner syndrome sex link. Turner syndrome is sex-linked genetic disorder occurring in female. It is linked to the X chromosome and appears only in females with XX chromosomes. Either one of the X chromosomes has structural defects or is missing, notably at the missing genetic. Information altered growth before and after birth and is responsible for most of the symptoms. Most cases are monosom X, whereby there is only one missing X chromosome. Others are complicated, and the individual have a chromosome with rearranged or missing genetic. These are known as mosaicism. However, a rare case involves inherited condition. The patient in this category had a missing X chromosome. The next slide I'm going to talk to you about is the reproductive sign and symptoms of Turner syndrome. Turner syndrome results in the loss of reproductive ability, mostly during childhood and before birth. The affected individuals have short stature, notably at 5 years of age. They reach peak growth at 5 years. In many cases, eggs die prematurely, resulting in the loss of ovarian function. In most cases, the ovary degenerated before their birth, and eventually one becomes infertile. Moreover, they do not experience puberty. Nevertheless, others, a small proportion, retain ovarian function. The next slide that I'm going to talk to you about is the structural sign and symptoms of Turner syndrome. Individuals with Turner syndrome manifest several structural developments. They have a webbed neck. As you can see in the picture, this young lady neck is different from the rest of us because of her Turner syndrome. They have a webbed neck, which entail an extra fold of the skin in the neck region and swelling and puffiness of the leg. As you can see, this child, her leg is all swelling and puffy. That's due to the Turner syndrome. Okay, once again, they have a webbed neck, which entail an extra fold of the skin in the neck region and swelling and puffiness of the leg, portrayed in this image. Notably, they have a high probability of having kidney defect and skeletal abnormality, beside a third of the individual have heart defect, which involve valve damage. Finally, they develop a prominent low hairline. This is observable at the back of the neck. Common symptoms include eye problem, broad chest, small low jaw, and bone problem. Okay, the next slide I'm going to talk about is the genogram and generational inheritance. The genogram obtained from Motte shows 4 cases where female patient aged 20, 25, 12, and 15 had Turner syndrome. The third generation is affected in all cases, and only females have the condition. Notably, the chart indicate that the condition is not inherited. The parents and grandparents do not have the condition. This shows a spontaneous and unpredictable occurrence on one of the family members. Importantly, it would hardly be inherited since the individual lost fertility. Okay, the next slide that I'm going to show you, it's related to the genogram and generational inheritance. I just wanted to show you an explanation. of the genogram. Okay, and the next slide, which is my references. Okay, these are the sources that I use to obtain my information. I wanted to say thank you so much for taking the time out of your busy day to listen to my PowerPoints. You are an amazing teacher. I appreciate the way you teach the class. You are making a huge difference in student life. Since I started this class, I have learned so much. It's only been 5 weeks. I cannot imagine how much more that I'm going to learn in the next 6 weeks. Thank you so much for working with each and every one of the students. I appreciate your hard work. You setting the student up for success. Thank you so much for your time. I wish you and your family all the best. Have a great year. Stay safe and happy. Thank you for your time. Have a great day again.